For the first time, we've got NICE guidance on how to commission care and support for people experiencing homelessness. And it's all the things that I've seen work time and time again, ingredients in a great recipe, from co-production, trauma-informed care, psychologically informed environments, and of course, multidisciplinary working.
In my early 20s, I had a lot of deaths in a very short period of time, and it was just too much for me to handle. So being in a big tough northerner, you didn't go to doctors for help, and you didn't go to sort of counselling and things like that. You just bottled it up, and you usually either turn to drink or drugs, and I turned to drugs.
The reason why I have a respect for NICE guidance is because one of the reasons is because actually a lot of work goes into producing the evidence on which the recommendations are based. And the thing is, you can trace it. So you can, if you wanted, you can go and look at some of the evidence that led to a formulation of some of the recommendation. And so that's the great thing about the guidance.
I suppose the next 30 years was a dark progression through various drugs, just avoiding the issues that I really needed to sort out. I had tried to engage over the years with different sort of healthcare services, and none of them seemed to fit me at the time.
A starting point is to become familiar with the guidance. Look at your local needs, get round the table from people in different parts of the system. Use the baseline assessment tool to look at areas of strength and areas for development, and thinking about implementation.
I mean, my journey was very different from anybody else's journey through homelessness. We aren't a group, homeless people aren't, it's not a group of people who are homeless, we're individuals, and each person is going through their very own journey of homelessness, and they need their healthcare to be sort of built around what they personally need, and I don't think that's really happening.
Commissioners should always look at the evidence for the needs of the population. Now, we didn't have a population needs assessment, but however, we knew what the areas were that we have concern to our people who are experiencing homelessness in our borough, and we knew what those themes are, and NICE guidance had done some research, some evidence around those themes, so we can build on those evidence. So for me, that was the first thing, is that evidence base, because it allowed you as a commissioner to see where what the evidence suggests the needs might be.
I mean, I've heard first-hand experience, I've seen it in the hospitals myself, where like nurses have sort of apologised that there was a homeless person in the waiting room. And human rights are rights for every human, regardless of who you are, what your situation is. I should be able to walk into a doctor's or a hospital and get the exact same level of care as anybody else in this country.
So where the evidence is saying that some of the intervention might work, and so that's what NICE provided. And as a commissioner, that then allowed me to be able to say, well, for example, in mental health, every service that's provided needs to be sensitive to the needs of anyone who's accessing it.
So helping parts of the system, health, social care, local authority, voluntary sector work together is so important, and this guidance really backs the need for that and the benefits all round.